If you're 75 and you go to the bathroom, stand up, take 3 steps, and suddenly feel like you still have urine left behind, listen to me carefully. That is not just an annoying little inconvenience, and it is not something you should automatically write off as, well, I'm getting older, because that half-empty, half-finished feeling can quietly turn into a miserable cycle. You go, but not completely. Then you feel pressure again, then you go back too soon, then the bladder never really empties well. Then the nights get worse, the urgency gets worse, the dribbling gets worse, and before long, you are planning your day around the nearest bathroom. A lot of people think the problem is just weak bladder muscles. Others assume it has to be the prostate. And sometimes, yes, the prostate is part of the story. Sometimes the bladder itself is more irritable. Sometimes the outlet is tighter. Sometimes the signals between the bladder and the brain are just not as clean as they used to be. But here's the good news. When symptoms are still in that mild to moderate range, there are often simple things that can genuinely help. And one of the most overlooked tools is not some exotic herb from the other side of the world. It's not a strange powder. It's not a miracle pill. It's one seed. Pumpkin seed. Now I know what some of you are thinking. Doctor, you're telling me a seed can fix something I've been dealing with for years? No, that's not what I'm saying. I'm not saying pumpkin seeds magically cure every bladder problem. I'm saying that pumpkin seed, used the right way, can support the urinary system in a way that many older adults find surprisingly helpful. And when you combine it with the correct bladder emptying routine, that is when you start giving your body a real advantage. So in this video, I want to show you exactly how this one seed may help support better bladder emptying, and then I want to go over the bathroom habits and daily routine that will give you the biggest return for the least effort. If you're 75 and you go to the bathroom, stand up and take 3 steps and suddenly feel like you still have urine left behind, listen to me carefully. That is not just an annoying little inconvenience, and it is not something you should automatically write off as, well, I'm getting older, because that half-empty, half-finished feeling can quietly turn into a miserable cycle. You go out, but not completely. Then you feel pressure again. Then you go back too soon, then the bladder never really empties well. Then the nights get worse. The urgency gets worse. The dribbling gets worse. And before long, you are planning your day around the nearest bathroom. A lot of people think the problem is just weak bladder muscles. Others assume it has to be the prostate. And sometimes, yes, the prostate is part of the story. Sometimes the bladder itself is more irritable. Sometimes the outlet is tighter. Sometimes the signals between the bladder and the brain are just not as clean as they used to be. But here's the good news. When symptoms are still in that mild to moderate range, there are often simple things that can genuinely help. And one of the most overlooked tools is not some exotic herb from the other side of the world. It's not a strange powder. It's not a miracle pill. It's one seed, pumpkin seed. Now I know what some of you are thinking. Doctor, you're telling me a seed can fix something I've been dealing with for years. No, that's not what I'm saying. I'm not saying pumpkin seeds magically cure every bladder problem. I'm saying that pumpkin seed, used the right way, can support the urinary system in a way that many older adults find surprisingly helpful. And when you combine it with the correct bladder emptying routine, that is when you start giving your body a real advantage. So in this video, I want to show you exactly how this one seed may help support better bladder emptying, and then I want to go over the bathroom habits and daily routine that will give you the biggest return for the least effort. Not a handful once a week, not a processed snack mix covered in salt and sugar, not whenever I remember. Daily, steady, boring, consistent. That is how useful foods usually work. So how do you actually use pumpkin seed in a practical way? Start simple, a small handful a day, or about 1 to 2 tablespoons of shelled pumpkin seeds. Plain is best, unsalted is better, dry roasted is fine, raw is fine if you tolerate it well. You can chew them thoroughly, or if chewing is difficult, you can grind them and add them to oatmeal, yogurt, soup, or soft food. And I generally prefer people take them earlier in the day or with lunch rather than late at night, especially if nighttime urination is already a problem. Many people ask me, do I need the oil or is the whole seed enough? And my answer is this: both the seed and certain seed oils or extracts have been studied, but if you are just building a simple, affordable, food-first routine, the whole seed is a very reasonable place to start. It gives you the nutritional package, it's easy to use, and most importantly, you are more likely to stick with it. That last part matters more than people think, because the common mistake is not that people choose the wrong seed. The common mistake is that they never give the right seed a fair trial. They take it for 3 days, forget it for 4, switch to something else, then declare that nothing works. Your bladder does not respond well to chaos. Most of the time, it responds to consistency. I also want to point out something important here. Pumpkin seed support is most useful when symptoms are still in that mild to moderate range. If the issue is a full blockage, severe retention, infection, major nerve problems, or something more serious, a seed is not going to solve that. So we'll talk about warning signs later. But for the large group of older adults dealing with age-related urinary frustration, this is exactly the kind of low-drama, low-risk support that can be worth trying. Another patient I think of is Marlene, 73, from Tampa. Her issue was less about a weak stream and more about frequent urgency, with that maddening feeling that she was never quite done. She was the kind of person who would go to the bathroom just in case 10 times a day. She thought she was helping herself. In reality, she was training her bladder to speak up too early and too often. When she added pumpkin seeds, she expected the seed to do everything. But what ended up helping most was understanding that the seed was only one part of the picture. It supported the system, but her habits had to stop sabotaging that support. And this is where we need to go one level deeper, because many people think bladder emptying is only about what's in the bladder. It's not. It's about the whole neighborhood. The bladder has to squeeze, the outlet has to relax, the pelvic area has to not be overly tense, the bowel should not be packed and pushing into the same space. The nervous system has to coordinate the timing, and the things you drink should not be irritating the lining every single day. That's why pumpkin seed helps some people more than others. It works best when it's placed into a body that isn't being attacked from every angle. So let me give you another practical tip. If you're going to try pumpkin seed, give it a real window. Think in terms of weeks, not hours. Use the same amount each day. Keep it simple. Notice whether the stream feels easier, whether the pressure after urinating is less, whether the nighttime urgency improves, whether the "I still need to go" feeling eases even a little. Small improvements matter here. A slightly calmer bladder can lead to better sleep, better confidence, and fewer interruptions across the day. And one more common mistake. People buy heavily salted pumpkin seeds and eat them late at night while drinking extra fluids. Then they wonder why they're up more often. Remember, if you're trying to help bladder symptoms, you don't want the support food to ride in on the back of habits that make the bladder more reactive. Keep the seed simple, moderate, and consistent. Now, once you've dialed in the right seed, the correct emptying routine becomes the multiplier. And this part is a big must if your main problem is that unfinished feeling after you urinate. Because here's what most older adults do wrong. They think the answer is to push harder. It's not. In fact, straining is one of the worst habits for this problem. If you think of the bladder as a gentle pump and the outlet as a narrow passage, brute force is not always your friend. When you push aggressively, you often tighten the very region that needs to relax. You create more abdominal pressure, more tension, more frustration, and sometimes you still don't empty well. So the goal is not violence. The goal is cooperation. And one of the most effective simple techniques is something called double voiding. Double voiding means you urinate once, then instead of jumping up immediately, you stay there a little longer. You relax, you breathe, you may lean slightly forward, then sit upright again. You wait maybe 15 to 45 seconds, and then you give your bladder a second chance to finish. Not with harsh straining, just with time and relaxation. It sounds almost too simple, but simple is often what works. I had a patient named Frank, 80, from Tulsa, who used to rush every bathroom trip. He would urinate like he was catching a train, shoulders tight, jaw tight, belly tight. Then he'd stand up, and 10 minutes later, he would feel that nagging pressure all over again. He thought his bladder was failing him, but really he was never giving it enough time to complete the job. Once he started slowing down, staying seated a bit longer, leaning forward slightly, then trying again, the difference was noticeable. Not because he got a new bladder, but because he finally stopped interrupting the one he had. That's the key. Many older adults are not just dealing with a bladder problem, They are dealing with a rushed bladder problem. Many people ask me, what if nothing comes out the second time? That's fine, then nothing comes out. You haven't harmed anything by giving the bladder another chance. But many times, that second pause allows a little more urine to leave. And that little bit is exactly what was causing the return trip. Now, if you're someone who stands to urinate and you feel incomplete emptying often, you may want to experiment with taking a little more time, softening the belly, not clenching the legs, and avoiding that hard downward push. If you sit, stay relaxed and don't spring up instantly. A few extra seconds can matter a great deal. And that brings us to another powerful idea. Timing. Just like the wrong eating pattern can make a weight problem worse, the wrong bathroom pattern can make a bladder problem worse. If you hold urine too long, the bladder gets overstretched and unhappy. But if you go every 20 minutes just in case, the bladder starts sending signals when it barely has anything inside. That creates a nervous, unreliable bladder. So the goal is a middle ground. Not ignoring the urge for hours. Not racing to the bathroom every time you feel the smallest whisper. A calmer, more scheduled rhythm helps. For many older adults, it helps to urinate when they wake up, then use sensible intervals during the day rather than waiting for a crisis or going constantly out of fear. If you're someone who goes every hour without producing much, you may need to gradually stretch that interval a little. If you go too long and then rush, you may need a more regular pattern. And again, when it's time to go, don't just check the box. Let the bladder finish. I remember Elaine, 78, from Sacramento. She told me, "Doctor, I go all day long, but I never feel empty." That sentence tells you a lot. It often means the bladder has been trained into small, incomplete trips. Elaine's biggest breakthrough did not come from a fancy supplement. It came from spacing her bathroom visits more intelligently, reducing late-day caffeine, and using double voiding at the end. The pumpkin seeds supported the system. The routine changed the behavior of the system. And just like with other body systems, consistency beats the perfect plan every time. A textbook perfect bladder routine you only do once in a while will lose to a simple routine you repeat every day. Now let's talk about the daily habits that quietly make bladder emptying worse, because this is where many people unknowingly ruin their progress. First, too much caffeine. Coffee, strong tea, and certain sodas can irritate the bladder and increase urgency in many people. Not everyone reacts the same way, but if you already struggle with incomplete emptying, frequent urgency, or nighttime trips, caffeine later in the day is often gasoline on the fire. Second, large amounts of fluid in the evening. I'm not telling you to dehydrate yourself, that would be foolish. But if most of your drinking happens late in the day, don't be surprised when the night becomes a parade to the bathroom. Spread fluids out earlier. Let the evening be lighter. Third, constipation. This one shocks people. But the bowel and the bladder are neighbors. If the bowel is backed up, it can crowd the bladder and worsen urinary symptoms. That means pumpkin seeds won't shine as brightly if everything else in the pelvis is under pressure. Keeping bowel habits regular can absolutely improve urinary comfort. Fourth, certain medications. Some antihistamines, decongestants, and other medications can worsen urinary symptoms in some people. Don't stop anything on your own. But if symptoms suddenly worsened, it is worth discussing your medication list with your doctor or pharmacist. Fifth, being too sedentary. Gentle daily movement helps more than people realize. You do not need to train like an athlete. But walking, stretching, moving the body, improving circulation, and reducing constipation all support the urinary system. The body is a set of connected rooms. When one room gets stale, the others feel it. I think of a man named Leonard, 77, from Charlotte. He was convinced his bladder had simply given up. But when we looked closely, he had 3 major aggravators: strong coffee all afternoon, very little walking, and chronic constipation. He added daily pumpkin seeds and expected a miracle from that alone. The improvement only became real when he cleaned up the other 3. That's when the pressure eased, the urgency settled, and he stopped feeling betrayed by his own body. So if you want the seed to work better, protect the environment the seed is entering. Many people ask me, should I be doing Kegels while I urinate to push the rest out? No, that is usually not the right approach. During urination, the goal is relaxation and completion, not repeatedly clamping down and interrupting the stream. If pelvic floor exercises are appropriate for you, they are usually done separately, not during the act of emptying the bladder. Now here's one more thing I always tell my patients. Do not judge progress only by one dramatic bathroom trip. That is a mistake. The better measure is the week. Are you feeling less pressure after you go? Are you getting up fewer times? Are you making fewer emergency trips? Is the stream a little easier to start? Is dribbling a little less frustrating? That is how real progress often shows up. And just like the scale can mislead someone trying to lose fat, one single trip to the bathroom can mislead someone trying to improve bladder emptying. You have to look at the pattern. If I were to put this into the simplest possible plan, it would sound like this. Use a small daily serving of plain pumpkin seeds. Keep them earlier in the day if nighttime urination is a problem. Don't expect instant fireworks. When you urinate, don't rush and don't strain aggressively. Stay a little longer, relax. Try a second emptying. Watch your caffeine. Lighten evening fluids. Keep the bowels moving. Move your body every day and be consistent long enough to let your body respond. That is not glamorous, but it is powerful. Now, before we finish, I need to say this clearly. If you cannot urinate at all, if you have severe lower abdominal pain, if you notice blood in the urine, if you have fever, burning, or a sudden major worsening of symptoms, that is not the moment to experiment at home. That is the moment to get medical attention. Acute urinary retention can be serious. Infection can be serious. The point of this video is to support mild to moderate urinary symptoms, not to ignore emergencies. But for the older adult watching this who is tired of that half-empty feeling, tired of getting back into bed only to feel the urge again, tired of standing in the bathroom waiting for the stream to start, tired of the dribbling, the interruptions, the planning, the embarrassment, I want you to hear this. You are not powerless here. You may not be able to restore your bladder to age 25. But you may absolutely be able to make it calmer, friendlier, more efficient, and less disruptive to your life. And that matters, because this is not just about urine, it's about sleep, it's about confidence, it's about being able to sit through dinner, take a drive, visit your family, go to church, go to the theater, or simply leave the house without mapping every restroom on the route. It's about dignity, it's about independence, it's about not letting a small private problem slowly become the thing that organizes your entire life. So start simple. One seed, the right way, the right routine, and enough consistency to give your body a chance to respond.